Hey guys, so I'm finally back on YouTube after like over 2 months. I'm so sorry that I haven't posted any videos recently. If you've been following me on Instagram, you'll know that this past summer was just so crazy for me. I actually, and again, if you don't keep up with me on Instagram, I just want to give updates to anyone who is just on YouTube, but I quit my NICU job because I had so much going on between school, clinical, and I was also planning a wedding, so I had a lot going on. I did get engaged, so it's been an eventful summer, but you know, I'm really gonna try to be more consistent about posting YouTube videos. I just feel like I haven't been able to make videos and post a lot more content recently, and so I'm trying to figure that out and see how I can balance this more into my schedule. YouTube videos do take a lot of work to do because I have to film it and I have to edit it and then upload it. So if you're like, I need more day-to-day updates, I need more resources on a day-to-day basis, then be sure to follow my Instagram. I'm gonna link that in the description box below. But I'm not gonna go too in-depth about everything else. I want to get straight to the video today. So today I really want to talk about how to deal with mean preceptors, because this is something that a lot of nursing students face and I get a lot of questions about it a lot. So I really wanted to come here and talk a little bit about what I have personally experienced in clinical as a nursing student and, you know, having a mean preceptor before and how to kind of go about that. So unfortunately it does happen a lot, and that's one thing that we as a nursing community need to fix more, is just that nurse bullying that does happen. And I don't want to say like older nurses, because it's not always older nurses, it's just nurses that have a little bit more experience that tend to pick on younger, scared, vulnerable nursing students or nurses. And so I really want to address it. If you are a preceptor and you're watching this video, then please like be aware of how you are when you're taking on students, how you talk to them, how you teach them. As somebody that is, you know, always mentoring nursing students and things like that, and even when I was working in the NICU, anytime we had new nurses get hired or anything like that, I always made sure to be very patient and kind to them because they're learning. And it's, you know, when you're new, you're scared, you don't know what you're doing, you're already overwhelmed, and then you throw in the anxiety of like having a mean preceptor, and it can even make it worse and just make the experience worse for a nursing student or a new nurse. So I really want to just talk about what I experienced before and just tips to approach the situation if you do encounter a mean preceptor, what you can do, what you should do, and just how to go about it. So I want to talk a little bit about my experience with dealing with a mean preceptor. So in my last semester of nursing school, I got to choose a floor that I really wanted to go do 72 hours of my clinical hours on, which was 6 12-hour shifts. So of course I picked the NICU because I was like, oh my god, I really want to go there. I'm so excited to learn. I want to get a better understanding of what NICU nurses do every day during their shift. And so I picked the NICU, and of course, when I got there, I got the one, I'm telling you, the one person that was really mean on that floor. And I actually ended up working there afterwards, but I'll talk more about that here in a few minutes. But, you know, that was the only mean person on that floor, and I got her as a preceptor. And there was this one day, like probably my second day there, obviously in nursing school, you don't encounter NICU. They don't even teach you anything about the NICU when you're in nursing school. Like, they barely cover high-risk OB stuff. And this preceptor was pretty much not teaching me anything. She was like delegating tasks to me, and so she just kind of told me to go start feeding this baby. And I was like, okay, I don't know anything about feeding babies. Like, I just assume you hold them like a normal term baby and start feeding them. And so I start feeding this 3-pound premature baby who has like a history of Brady episodes, apnea, obviously an like 24-weeker, barely good at eating, like really not eating very well, and has a lot of DSAT episodes during her feeds. And I don't know any of this. I don't even know this stuff happens. And this baby was also on a nasal cannula, so I start feeding this baby like a normal baby, and the alarm starts going off. This baby's heart rate keeps dropping, oxygen level keeps dropping. She's not even really latching onto the bottle very well. She's like choking on the milk, and my preceptor wasn't even with me. She was feeding another baby in another room. So I was like panicking because I was like, I don't know what I'm doing. I don't even know how to feed a baby like very well. I don't even have kids of my own. And you know, you throw in like a premature baby and I have no idea what's going on, why the alarms keep going off. So I was like freaking out. And eventually this preceptor shows up to the room because she keeps hearing the alarms, and she starts yelling at me, and she's like, you are never going to be a good NICU nurse. You don't even know how to feed babies. You're not supposed to feed them like that. If they're on oxygen, you should know to feed them sideline, blah, blah, blah. And being a nursing student who was excited to go into the NICU, that day I was so upset. I went to the break room. I pretty much was like in tears, and I just kept questioning myself. I was like, how am I ever going to be a NICU nurse? Am I not meant to do this? I pretty much kept questioning myself after that day. I was so upset, and the rest of my time there, I was just so scared of this preceptor. I was so scared I was going to do something wrong. And I mean, there were so many things that this preceptor did wrong anyways, looking back on it, because as a NICU nurse now, if I had a patient like that, I would never in my life let a nursing student that is never trained in the NICU to feed a baby that is having DSATs and, you know, is X24 weaker, barely latching onto the bottle. But you know, I wish I had done more about that situation. I wish I had went to the manager. I wish I went to my instructor or did something about it, because I'm sure there were other students that had her as a preceptor after, and maybe they didn't have a very good experience either. But I'm so glad I didn't let that one preceptor or that experience change my decision to go into the NICU. In fact, I ended up working on that floor. I just happened to apply there even though I was very hesitant, and I'm so glad I did. I had such a good experience. It was my first job. I had such a good experience working there. Everyone except for that one nurse was so nice, so great when I was a new grad nurse, always willing to teach. The manager was great. And the funny thing was that mean preceptor was not mean at all once I started working there. So I don't know if it was just because I was a nursing student or what. So my point being that, you know, if you do encounter a situation where someone's belittling you, they're not really going out of their way to teach you, you know, or just make you feel encouraged as a new nurse, like, don't let their harsh words get to you. Don't doubt yourself, because some people just, I don't know what their problem is. They just have insecurities or problems in their own personal life, and they are frustrated with their job, and they like to take it out on new nurses. So that was like my experience, and honestly it did traumatize me, but that situation has kind of become the reason why I started my page on Instagram, why I'm always mentoring students, because I always want to encourage new nurses. It's very scary to go be a new nurse and to learn so much about handling a person's life. So that's exactly why I do, and that's why I want to share what you can do if you encounter this situation. Okay, so my first tip, if you encounter somebody like a preceptor or whoever it is yelling at you, is just don't yell back, don't fight back, don't get feisty with them, because you know, they always teach you, like, if someone's, even a patient gets combative with you or fights with you or whatever it is, you want to just stay calm, because the more you yell and say things back, it's just going to aggravate the situation. So, you know, you're a professional, you're a nursing student or you're a new nurse, you want to make sure you remain professional at all times, because at the end of the day, you don't want it to be like, okay, well, yeah, she said this, but you also did this, you know? You want to just remain calm, just be professional, and if they're yelling at you or anything like that, you can just tell them, like, hey, I don't appreciate the way that you were talking to me. I'm, you know, gonna go to the manager and tell them about it if you don't calm down, or if you talk to me disrespectfully, okay? You never want to just sit silent, because you don't want someone just disrespecting you like that, but you also don't want to just start yelling at them and aggravating the situation and arguing with them. So my first tip is just stay calm and try to just control your emotions. It's hard. Even the day that I had that nurse yelling at me, like, I controlled myself, but then when I had time, I went to the break room and kind of started crying a little bit to myself, and then gathered myself and went back out there. So if you need to go to the bathroom, yell, just throw something, like, do what you need to do in your own time, but try to just control your emotions while you're on the floor, because patients are watching you too, and you don't want to get in trouble for that. Now, if you're like now it's harder with nursing students just because you're not working on the floor. Sometimes the preceptors you get are not really even people that volunteered to precept nursing students. They're just assigned to them randomly that day, and that just throws them off and they get upset about it. So if you are a new nurse who's orienting, or even if you're a nursing student, tell the preceptor if they're not explaining something to you. Just tell them, be like, I don't understand what you're saying, or I don't understand how to do this, could you please explain it to me? Because like I said, in my situation, this nurse did not teach me one thing and just threw me into the situation, and that's what freaked me out even more. So, if they're telling you to go do a task and you don't know how to do it, be honest. This is your time to learn. You're the new grad, you're the one orienting, or you're a nursing student. It's their job as a preceptor to teach you how to do it. So don't be afraid to just tell them, like, could you please explain it to me better, or I need another way to learn this. Because you don't want to ever just sit silent because you're scared and then do something wrong that could harm the patient, or even just not learn it the right way, and then when you're on your own you don't know how to do it. Now, if you're in school, you are dealing with this really rude preceptor, I want you to report it to your instructor for sure. You definitely want to report it to your instructor, that way they don't ever assign this nurse to another student and ruin their, learning experience, okay? Now, if you're a student and you're like, I reported it, but they didn't do anything about it, which does happen because sometimes, instructors will go talk to the manager or whatever, but maybe it just gets lost in the process. So I say, like, don't be afraid to go directly to the manager. If you see the manager's office over there, just go, when you get a chance, go talk to them and say, hey, I'm a student, but I want you to be aware that this nurse that I worked with has been extremely rude. Because honestly, they shouldn't be having nurses like that on their floor. If they can't be kind and respectful to nursing students, who's to say they're being good to their patients? So don't be afraid to report it. Now, if you are a new grad nurse and you're dealing with this, or even just a nurse orienting to a new floor, yeah, you definitely need to report it to the manager, okay? If the manager is not doing anything about it, then I would be concerned. I'd be concerned that I'm not working in a good place. If they're okay with having people like that on the unit who are toxic and bullying, and they're not doing anything about it, then that, I would say, is a concern overall. And you should go even higher up than the manager to report it if it comes down to that. But at least go to the manager, see what they can do about it. Definitely try to get your preceptor changed if you're a new grad, because you don't want to spend weeks orienting with somebody who scares you and then you don't learn anything and you just have a bad experience. It's going to burn you out faster. You're going to dread going to work. So get your preceptor changed if you can. And then finally, I just want to say, always remember, especially if you're a nursing student or a new grad, you are new to this, okay? This is a learning process. Nobody became an experienced RN overnight. It takes time to learn things. It takes time to feel really comfortable doing things. Even after 3 years of being in the NICU, there were certain things that I didn't always take care of, like high acuity patients and things like that. For example, I never really had to start IVs. Like, most of my patients were always feeder growers, or I would get babies that have like central lines, and so I never really had to start IVs. And even after 3 years, I would go ask other nurses to come start my IVs. So just know that, like, you're new, this is a learning process, it's gonna take time, and just don't beat yourself up over it, okay? And don't let other people's, rude words get to you, because I don't know why people bully and why they're mean. They obviously have some kind of problem in their own life, and they just like to project it on others. So just remember, like, mean preceptors, you shouldn't let it get to you. And it's hard because when someone hurts your feelings, like, you just feel really bad, and you just question yourself and you're like, is this the right career for me? But just know that there's ways that you can try to avoid the situation. So just remember, you know, if you're working in an environment where people are always bullying you and they're just rude and toxic, you never ever want to stay on a floor like that. It doesn't matter if you're a new grad or whatever it is, like, that is not okay. You want to work in a supportive environment where people are going to encourage you to become the best nurse that you can be. And then, you know, if you become a preceptor, you're a preceptor, like, please always, like, stop and ask questions. Like, make sure to ask the student if they feel comfortable, if they're not sure about stuff, and don't ever yell at them or make them feel like they're stupid if they do something wrong or they're not doing something the right way, because again, they are learning. This is a learning process, and so it's very important that we encourage our new nurses. So I hope that this video kind of helped you, and I hope that, you know, if you are, I hope that you're not in the situation that I had when I was a nursing student, but if you're in that situation, I hope that this video helps you and encourages you to keep pushing, because I'm sure that you're going to be an amazing nurse. So if you like this video, I promise I'm going to start posting more videos, so make sure to subscribe to my YouTube channel. Just know that, you know, if you ever need help with anything, I offer coaching sessions, and I'll put the link to my services in the description box below. And make sure to follow me on Instagram too, because I post a lot more on my Instagram page on a day-to-day basis. Alright guys, well, I hope you enjoyed this video, and I will see you guys next time.